While many key elements of the Affordable Care Act don't go into effect until 2014, the ACA is already making a major impact on the pace and direction of hospital construction. As hospitals work to maximize value and improve medical outcomes, many institutions are building fewer new or replacement hospitals while continuing to spend on renovations and outpatient facilities. Those are some of the key findings from the 2012 Hospital Construction Survey, produced by Health Facilities Management Magazine and the American Society for Healthcare Engineering. I'm Hayden Bush, Senior Online Editor for Hospitals and Health Networks magazine, and I'm joined today by Mike Herkowitz, Editor of Health Facilities Management Magazine, to take a closer look at this year's survey. Mike, thanks for joining me today.
Thank you, Hayden.
Mike, this year's survey takes a close look at how health reform is beginning to impact hospital construction. What are some of the key findings?
As you can imagine, Hayden, hospitals are paying much more attention to their bottom lines, and any new projects have to pass very rigorous financial reviews. But in addition to ED and medical office building expansions, many of the projects that are being approved as a result of reform legislation are smaller structures, such as outpatient facilities, primary care clinics, and urgent care centers.
And overall, what trends are you noticing around facility and departmental projects?
Overall, there's a lot of expansion and renovation work in acute care hospitals, as well as new construction of medical office buildings and upgrades of infrastructure plants. Moving down to the departmental level, again, emergency departments are seeing a lot of construction activity, as well as imaging departments and surgery spaces.
And what trends are you noticing in terms of patient safety design, both for overall facilities and for specifically inpatient rooms?
In the facilities in general, there's a very big emphasis on design elements to encourage staff hand washing. Hospitals are also emphasizing noise reduction to enhance staff and patient communication, and decentralized nurses stations to bring clinical staff closer to the patients. In the patient rooms, wireless technologies for staff, in-room computers for patient charting, and in-room sinks, again for hand washing, are the top safety features.
And finally, what are some of the findings this year around disaster planning?
Interesting question, Hayden. The rash of natural disasters over the past couple of years, as well as ongoing preparations for possible mass casualty scenarios, has forced hospitals to maintain a sharp edge. Fully 54% of respondents have conducted assessments of their existing facilities over the past 24 months, while others are assessing the possible vulnerabilities within their new construction and renovation projects.
Thanks for joining me today, Mike.
Thank you, Hayden.